Good afternoon, everyone. And on behalf of all of us here at ShareBaby, I'd like to welcome all of you to our first of many, many future presentations and panel discussions. As you all know, ShareBaby is the diaper and essential needs bank here in Baltimore City. And since we do not provide directly to folks in the community, we work with trusted partners who are already embedded in the community, and they distribute essential care items to families with babies and small children. So today we're going to be talking with experts from 4 of those dedicated partner organizations as we discuss material insecurity and maternal well-being as we close out our Maternal Mental Health Month series. So I am your host and facilitator, Nadya Dutchin. I'm the executive director here at ShareBaby. You should see our co-host, Alicia Sindlinger, who is our marketing and communications manager. I'd like to take just a quick second to introduce our wonderful and amazing guests. I'm going to be reading from their bio, so if I sound like a robot, please forgive me. But I don't want to miss anything because they're all amazing women and supporters in this community and servant leaders. So I want to make sure I get everything actually correct. So first off, I'm going to introduce Anna Rodney. She's a practicing doula, and she's been doing so for nearly 18 years. She's also a yoga instructor, energy healer, and wellness practitioner based right here in Baltimore City. Anna is currently the Director of Advocacy and Public Policy for the Doula Alliance of Maryland. She's also the founder of Mom Cares and the Rising Mama, a wellness organization that centers mothers in the delivery of care and support to the entire family unit. Anna serves as Baltimore City's Women's Commissioner and supports the legislative policy agenda for the commission. Anna is the chair of the Baltimore City Maternal Mortality Review Board, as well as a member of the Fetal Infant Mortality Review Board. Anna has been acknowledged by the Public Justice Center for her contributions and collaborations in policy in maternal health. Apologies. Beth Watkins is the deputy director at Asylee Women Enterprise. It's a Baltimore nonprofit that serves asylum seekers, immigrant traffic survivors, and other forced migration. I'm sorry, it's as a forced migrants. I'm sorry, as they navigate the immigration legal process and heal from past trauma and rebuild their lives right here in Maryland. Beth has been with AWE for almost 5 years and manages multiple staff teams, activities, and programs, including AWE's Survivors of Torture program. Beth has spent over a decade working with refugees and asylum seekers, including 6 years in North and East Africa, and has an MA in refugee protection and forced migration studies from the University of London. She's also the mother of a very busy toddler. I'm sure Beth probably needs a nap shortly hereafter. Teneele Bruce she's currently serving as the maternal health coordinator with Baltimore Healthy Start and was a project team member on the Merck for Mothers Safer Childbirth Cities Initiative, which aided in lessening the burden of maternal mortality and morbidity in the city of Baltimore. She has facilitated and led qualitative research work and with patients in order to understand their experiences with giving birth in Baltimore City hospitals. Teneele has over 6 years of experience serving in progressively responsible roles in the field of maternal and child health, including but not limited to community birth work as a doula, nonprofit leadership, and policy work centering birth equity and reproductive health in the state of Maryland. Currently, she sits on the Fetal Infant Mortality Review Committee and Maternal Mortality Review Committee with the Baltimore City Health Department. And last but not least at all, we love Maria. Maria Fernandez is a certified community health worker, certified lactation educator, and certified interpreter. She has served the community for 17 years as a part of Baltimore Medical System's perinatal team. Maria focuses on the Be More Healthy Babies community in Patterson Park, North and East, where she distributes resources and facilitates groups primarily in Spanish, but also in English. She's a hands-on leader whose passion is to support, educate, and empower her participants by providing information, resources, and encouragement. So welcome to our amazing, wonderful panelists, and thank you all so much for all of the amazing work that you do liaising between ShareBaby and members of the community. So before we get started, I just wanted to welcome again all of the audience members. And I wanted to let you know that we're going to be sending out a few polls throughout the presentation, and we'd really, really love to hear from you to get a better understanding of who you are, what your understanding of the topic is, and your current and future engagement levels on this topic. Also, we'd love to know a little bit more about the topics you'd like ShareBaby to address in the future. Although answering is optional, we really value your feedback and we would love to hear from you. So please, at your leisure, do answer the polls when you get a chance. I think Alicia's just posted the first. So for our first question, we'll go ahead and dive right into our audience Q&A. Or I think one of the first questions we did send out the questions ahead of time to our panelists. And so what we'll do is I'll direct the question directly to the panelists who said that they would answer. But panelists, if any of you want to chime in, if something comes up for you when one of our colleagues shares their answer, please feel free to weigh in and say you give an answer from your perspective. I think the very first question that we have is, what are the kinds of healthcare and support that pregnant mothers and mothers to small children need? And will give my personal experience. We know that, from me for giving birth and being pregnant, particularly as a very, very much older woman, when I had my child. Prenatal care is critical, but prenatal mental health care is also critical, and ensuring that you have community support. And when I mean community support, I don't just mean people in your neighborhood, but your own personal chosen family and friends community. Being a parent is really hard, and I think doing it alone, a lot of people do that, but doing it alone is unfathomable, and it makes parenting and being a mother and being healthy impossible. So from my perspective, those are the kinds of healthcare and support aspects that folks need when they are pregnant and working to take good care of their children after they deliver. Again, physical health care and mental health care absolutely critical to those to us being healthy mothers and being good good parents to our little ones. One of the things that I know that we talk about a lot, and in our I guess in the realm of work that we work in, um, is, we talk directly about healthcare, we talk directly about support, but I'd love to hear from you, Teneele, about the social determinants of health. What is a social determinant of health? What does that mean? And what aspects of that do you see here in Baltimore City?
Absolutely. So, when we're talking about social determinants of health, or community factors, as we're now seeing them branded as, we're thinking about and we're talking about conditions or factors, and these are non-medical in nature, and how they can impact a person's health outcomes, their quality of life, or just their overall functioning. And they typically occur within the environments where we live, work, and play, and also age. So in Baltimore City, just doing the work that we do at Baltimore Healthy Start, we see a lot of food insecurity. We see a lot of housing insecurity. We also see barriers when it comes to transportation, childcare, also other forms of material insecurity, which we'll, of course, dive into as we progress in the discussion. And then also just, deepening disparities in access to care overall, but more specifically, mental health resources and services. So those are just some of the major things that we observe at Baltimore Healthy Start. And More recently, we're also starting to see insecurity around just other more specific materials. So when we're talking about the life course perspective, if you're looking at, before a woman gets pregnant, so if you're looking at perhaps younger women, honestly, anyone within childbearing age, uh, we're looking at feminine hygiene products and just the access to that and period poverty. So, that's something that, has recently come across our radar. And, all of these are unfortunately issues that a lot of our clients and families encounter.
Thank you so much for that answer, Teneele. And Anna, I know you wanted to contribute to the question. Please feel free to share.
Yes, thank you. And so Teneele did a great job, like busting the answer open. But I think also when we talk about the social determinants of health, it's really like every single thing that's around us, right? It's our
Mhm.
environment, it's everything that we interact with. And so, one of the things that we actually talk about when we're reviewing cases on both the FEMA and the MMR board is the tree canopy, right? And so we need to think about also the environmental factors that influence families and their health during pregnancy and the perinatal period, right? And so, environmentalism, you is not something that you would necessarily think has a intersection with maternal health, but it absolutely does, right? Because if I don't have a space, if my air is not clean, right? If I am in the footprint of the incinerator, and we know that those neighborhoods have higher instances of asthma, right? Like if I'm in a space where my environment is also um, impacting my health, that is something that is going to trickle down into my
Right.
child, into my family. And so it's something that we also need to think about, especially in our current climate, pun intended, to think about as far as safeguarding. And so when I think about that in connection to um, material insecurity, something as simple as a fan, right? Or or education around space heaters. When we talk about FEMA, and we talk about these deaths and these losses, especially in the wintertime, there's usually some type of a space heater or something, a situation involved in some of the fatalities that happen across our city, right? And that impact our families. So I'm thinking about thinking about the fact that the tree canopy and being able to go outside and see green, and being able to go outside and feel comfortable outside, really. And so we're moving into the idea of just safety, feeling safe to go outside. I can say personally, when my boys, they're still young, but when they were younger, I lived in a neighborhood that had crime that was happening. And there were two shootings in the space of a month outside of my window. And so if I don't feel comfortable letting my children go out to play, that's going to impact their health. If I don't feel comfortable going out for a walk while I'm pregnant, that might help with my blood pressure, might help with some of the other things that I'm dealing with, that's going to impact my pregnancy and my children. And so I think there are, all of these things weigh down onto our mental health, right? Because there is that mind body connection, mind body spirit connection, in which everything is really interdependent on the other. I'm going to leave it there because I could talk about this all day long, but I think that's enough.
Absolutely understandable. I mean, I think it really speaks to the fact that everything, everything matters. When you're pregnant, when you are, raising a family, everything matters. There's not a single factor that does not impact you and your family. And so, in order to be healthy and, again, have healthy families, healthy children, things really need to be right. But we live in such an interesting city that has some unique challenges that are common in places that are like us. So Baltimore, Philly, Chicago, there are some urban areas that are, that face some of the same things, but because Baltimore is particularly so old and has some interesting infrastructure, and we're affected by crime like everyone else, there are, other things that are outside of our immediate control that really do affect us. So I really appreciate both of you answering that. Does any one of the other panels would like to comment? All right, well, we will move on. Thank you so much for your answer. We'll move on to the next question, which is how often do you see maternal mental health stress indicators in mothers who come to you for services? What are the contributing reasons? And I believe, Beth, you offered to answer that question first.
Yeah, so most of the clients that we work with are immigrants. Most of them are survivors of torture, survivors of human trafficking. They've fled their home countries to come to the US seeking safety and protections here. So most of the clients we serve and the mothers that we enroll have been in the US for less than a year for quite a short period of time. So a lot of the clients that we see coming in they're in crisis mode, right? So in terms of, the maternal mental health stress indicators, stress, anxiety, depression, difficulty sleeping, difficulty or appetite changes, mood, I mean, we see it in, I would say, almost all of the mothers that we serve to some degree, and some come presenting with all of those stress indicators. And I mean, I think just like my other esteemed panelists have said, it's a similar thing. It's kind of everything, right, that contributes to it. Most of our clients are housing insecure. Many of our clients are in the process of applying for protections or immigration relief. So they either are very confused by the process and overwhelmed by it. They are awaiting their work authorization. So most of them aren't permitted to legally work. So that affects housing, it affects food, it affects their ability to purchase what they need for children. The American healthcare system, even for a US-born English-speaking person, can be incredibly complex and difficult to navigate. And many of our clients have additional barriers to that. So those are all things that we see, like limited English as a barrier, understanding what they are, how to ask for help. And, when it comes to the point where we enroll clients, a lot of times like, okay, do you want mental health help? Do you want us to, usually they can't even sort of fathom all of the things that they need help with at that point, or sort of just pick one or two for us to really focus on initially. And the mental health kind of will come later. A lot of clients say, okay, well, like I need food, I need help finding housing, and then therapy needs to wait until I submit my application, or kind of things like that. So yeah, and I think as well, what we're seeing now is an increase in the criminalization of the clients that we serve. And I think many of our neighbors in Baltimore. Baltimore has a very high immigrant population, and also, has a lot of other systemic challenges as well. So I think that seeing the increased criminalization of our clients, of their fears about being returned to places where they might be put in danger or being separated from their children. I mean, it's really all of it. I think those are it's an overview of some of the contributing reasons, but I think we see it a lot. I'll just end with one example. We had at the end of last year in December, we had a mother come to us. She was 7 months pregnant. She'd been in the US for less than a month or two. She had with her a 7-year-old and a toddler, and she had been sleeping unhoused. So she came to us sort of just sort of in crisis mode, almost sort of like not emoting anything at all. And just you could tell she was sort of barely functioning, just a lot of fear about what was going on there. And sort of with being able to provide, I mean, even the first day we gave her diapers for her toddler, provided food, doing some of this, and like just meeting some of those immediate needs, you sort of see, okay, like kind of coming down and starting to feel safe. And I think that's why, I mean, I think you don't want to sort of touch on everything, but it just like, for many of the other questions I think that we have coming, it's really a lot of it. It's really everything. Thank you.
Thank you so much, Beth. Would anybody else like to contribute?
I'd also like to add that just the piece that we saw a lot when I was heading mom cares, was that a lot of our clients were coming and navigating some aspect of domestic violence. And because of that, that's a stress in itself. But, some people are like, oh, well, why don't you leave, create a plan. And it's so easy when you're not, managing it or navigating it yourself. But in the space of managing or trying to get out of a domestic violence situation, sometimes that domestic violence also comes with financial support. And also you're also in that situation because there is some financial relief. At least you're sharing the bills, or someone you have a roof over your head. There are other factors. And so to leave a situation like that while you were pregnant, or to be navigating that while you were pregnant, puts a strain on you, because there's shame, there is judgment, there are lots, you're physically unsafe, most of the time. And then you're also thinking about, well, my option to go, or my option to flee the situation, puts me at risk for now being unhoused. It puts me at risk for now not having access to things that my baby needs. It puts me at risk. And so it's really, it's really a heartbreaking choice see and to hold space for when a client is moving through that, because you absolutely want them to be safe, but you can't force that type of a situation, because there are so many factors that that are in play at that point. I think also, you know, as Beth and Teneele have also talked about, like, it's just the barriers and the challenges that we're seeing in the city as far as families are concerned. There are a number of contributing factors, and I think what's beautiful about this panel is that there's a representation of different organizations that are taking care of different parts of that question, different parts of that need. And so I'm very grateful to be able to sit on this panel, having sunset my organization last year, but still being invited into this space. And so I think that that's something that we really need to understand, and that it's not just a diaper, right? Like it's safety. It is there's a space that is created in your mind for all of the other things when you have that diaper in your hand, when you have that formula, when you have those baby clothes or that pack and play. When those things start to be taken off of your plate, you then have more space for the less immediate things, right? You've got this baby, this person and growing inside of you, reminding you need X, Y, and Z. So as those things become relieved, then you have more space. And I think scientifically, being able to ease the stress of mom or parents around that does have an effect on baby, because we know that stress, anxiety, the baby feels what mom feels. And so in any way, shape, or form that we can do things to relieve that, we're also trickling down into the mental well-being and health of that baby as well.
Thank you so much, Anna. And I think the next question is really a follow-up question to that. In what ways does the lack of access to essential for children affect a mother's mental well-being? And you began to speak to that a bit, so would you mind elaborating a bit?
Absolutely. I think that it's kind of, you know, Maslow's hierarchy of needs, right? Like if I have food, if I have shelter, then I can think about the larger part of my life, right? And so if there's so many things that are happening in your brain. So I have two children, and whether they were planned or not, one was unplanned and one very much was, but I had very similar feelings about, oh my goodness, there's so much to prepare. There's so much to do to prepare for this life, right? And so having those different parts of it, those different types of experiences within my own experience, I'm confident in saying that it's something that we deal with as parents, period, right? That need to feel prepared. And unfortunately, the perpetual feeling that you're not prepared, right? And so we also need to think about like the chemical changes that are happening in the brain, right? And so if all I'm worried about is getting food to my baby, but so I'm going to stop breastfeeding because it's too hard and I don't have the support, we have to also take into effect that there's a chemical shift that happens in your brain when you decide to breastfeed or whenever you decide to stop. And that fluctuation, if it's not if you're not guided or supported in it, can have negative effects on your mental health, right? But I don't care about that. I just need to go back to work. I need to know that I'm stable in this other space. And so what having support and education and the physical needs and the material needs of a pregnancy mean is that mental health piece that often takes a back seat is now allowed to hold space and now allowed to come to the forefront. And so I think in Black and Brown communities in particular, the idea of mental health is still taboo somewhat, right? We're still kind of moving around like, oh, I'm not crazy, I don't need that, you know, and so we don't want to pay attention to it. But I've had clients who've come to me and they have 2-year-olds and they're like, I think I have postpartum. And so what we don't know is that postpartum can last up to 3 to 4 years after the baby is born. We don't also take into account that the supporting parent, the father, can also have postpartum depression. But if
Mhm.
I am focusing on the survival aspect, I don't have the space to take account for what's going on mentally and how that's affecting myself and my family. And unfortunately, tragedies happen. You get stressed out, you get tired, you get exhausted. And we see things happening all the time that could have been prevented, right? And also, I think when we're talking about material need, that also requires us to go into the community, right? It also requires us to acknowledge I need help. And so that community component is just as important as the need, right? Beth giving that diaper, that bag of diapers to that mom says, I am here for you. I see you. I am supporting you. You can come back if you need more, right? That is a bridge that is being created just by that handoff of diapers. And I think that it cannot be understated that taking care of material needs for families also is a community building component and tool that is important for when that family needs to reach out for something else, right? And so now when that mom is in need of mental health, and it's like, oh man, I need to talk to someone, right? I know that Beth has a resource. I can go to Beth and say, you gave me a resource in diapers. Do you have a resource for this? That's trust building. And I think it's very important. I'm not, I feel like I've kind of strayed from the answer, but I think that we really need to understand how interdependent these services, these supports are as they show up in ourselves as just community members, and in our organizations, right? We're before we are part of our organizations, we're community members, right? And so the practices and the things that we're seeing don't turn off at 5 o'clock, right? Like when I'm in the grocery store and I see a mom struggling, oh baby, do you need help with the baby? I can hold the baby while you try to get that cereal off, or I can get the cereal for you, right? Like it's really important to understand that family and community is all of our jobs, right? Um, and that in itself does something for someone's mental health.
Anna, that's absolutely, you didn't stray from anything. I think you really hit on it because some of us are so tired or so stressed out, we don't know that we need the help. And I think recognizing, oh, I do, to your point, I need this diaper, I need this stroller, I need this whatever item, and I'm going to trusted partner location wherever. Someone there is going to see that mom, that family, and say, oh, let's talk. What else do you need? And to your point, we have this amazing network of partners. We have 73 some odd partners that are exclusively ShareBaby partners. And then we have these amazing partners that work directly with the Baltimore City Health Department, where all of these amazing services live. And we can literally wrap our arms around them as a network of organizations together. And I think that piece is really critical. We cannot underscore how incredibly important real, actual community is. So thank you for saying that. That's really profoundly important, actually. Did anybody else want to answer or add something to that? No? Okay, we will go on to the next question then. I believe this question is going to be directed to Maria. Do mothers feel isolated or judged when they struggle to meet basic needs for themselves or their children? How does this impact their mental health?
Okay, I've been working with the Latino community for many, many years. And one of the things that I noticed, that my Latino community that I work with often face a judgment for having a larger families compared to other populations. So this leads to many women feeling embarrassed to ask for help when they need it. I believe this hesitation is rooted to the fear of being judged, which can prevent them from seeking assistance in a timely manner. But sometimes many people sometimes they don't know that sometimes that is not up to the woman to have it. Sometimes their husband or the partner, they control those women that much that sometimes they will force them even to have more babies. And of course, she's sometimes she has those situation, domestic violence. The husband, they don't help too much, don't provide what they need. On top of that, sometimes they don't let them to work. It's a lot for them. And then I try to help as much as I can. We try to educate our Latino community, but it's sometimes the medical or system, sometimes it can be racist too, I believe. And sometimes they don't feel like they trust nobody to tell their feelings, to open up. And sometimes they just keep that everything for themselves, which is even worse for their mental health. But when they found people like me, for example, in the community, that we absolutely don't not judge no one. We try to be on their side. We try to understand. So we create this like how can I say, like they can trust us. They can come to us, and they feel much better that way. So I have a lot of cases that especially, well, right now I have a woman who is in the hospital who gave birth, and she doesn't know where she's going. She doesn't have a house where she can go. One of my participants, she offered her house for the meantime, but that's one of the problems that we have right now. Like, they don't, housing is a real problem right now. And when we try to help them with those items that I provide from ShareBaby, like diapers, whatever you have available, you do have available a lot of stuff, and those stuff that really make the difference on them. At least that, release a little bit stress to them.
Thank you so much for that answer, Maria. I think, we did an interview yesterday, and one of the things we were talking about is that, almost all the families that we collectively serve are considered transient, necessarily like homeless, and there are plenty of people who are. But folks just don't have a place of their own, and they're moving from home to home to home, whether it's with friends or family or a community member. So having being able to share the items that are portable, you can fold up the things and go. We know it helps, and we can see the relief on your faces when you call us and say, "Hey, do you have X, Y, and Z?" And you come and pick up the thing, and you're really, you're happy, and in turn, we know that it's going into the hands of a family that truly needs and appreciates the item itself, but more importantly, it's just critical for their actual day-to-day survival. So the work that you all do, in the community is really super important. Is there anyone else who'd like to answer that?
I'm such a chatty Cathy. I'm trying not to be,
Love
but
Oh.
I also really want to highlight the fact that in many of our communities that are being served by ShareBaby, the position of need is also a position that makes you vulnerable, right, to larger systems, right? And so when I'm listening to Ms. Fernandez talk about her family who doesn't have a place to go, that's something that I can't really share with everybody if I'm in the hospital and tell everybody, hey, I don't have a place to go, because that will equate to other systems being involved, my baby potentially being taken away from me, right? And so me reaching out for help sometimes can put me in a space of more danger, right? And so I think that that's absolutely isolating, because you need help, right? But also historically, I think that there's a lot of things that that systems are starting to do and awaken to rectify that relationship. But historically, it's known that if I don't you can't look crazy because they're going to come and get your baby. So I can't talk about my postpartum. You can't look like you can't take care of your kid because they're going to come and take my baby, right? The they that's going to come and take something as opposed to being generative and being supportive and being helpful. And I think that it's important to name that, because we can get into these spaces and be like, oh, well, we have all the resources. Why aren't you asking for them? Why aren't you, taking them? Or what's up with, why am I just hearing about this now? It's because there's a very urgent sense of danger around feeling like you are not able to provide care for your child in the space of material needs or housing or, other things that could keep yourself safe. And so when I'm looking at the word isolation, I think it's maddening to know that you need help, to be open to help, to want help, but also be terrified to have to acknowledge that help because it could potentially put you in more danger.
Right. And we've seen it time and time again, and we've heard stories about CPS removing children from a loving family because they didn't have the things or the bandwidth, the capacity to actually care for their children well. So removing children and putting them into a foster system, paying someone else when you could have simply just provided their family with the support that they needed. The brokenness of that piece, I think it's systemic and it's widespread, and we see it all the time. But to your point, I mean, um, I don't think that's something that we talk about enough, about the actual precariousness of need, and the isolation that can prevent you from actually asking for help, but even understanding like who can actually help and not harm. And it's so pervasive, in the city and in other places in general. I think as America, we are doing family quite wrong. I say it quite often, but we're not doing family well here. And we don't provide the kind of supports for families so that they can get to, through a healthy birth, to delivery, to a home, to support, to aftercare, all of the things that we know need to happen. And it can be as as basic as that, but I think we overcomplicate things so much. But that was really an important piece to highlight, Anna. Thank you. Did anybody else want to contribute to that?
Just to quickly add to what Maria and what Anna and what Nadya have contributed to this question, the tragedy is that we see a lot of this during pregnancy. So we unfortunately see a lot of women experiencing those feelings of isolation and judgment and feeling like they are pregnant and giving birth in a silo during pregnancy. And it just becomes a snowball effect and a perfect storm that goes right into the postpartum period after baby is here, those feelings of isolation and judgment, keeping, wanting the help, knowing you need the help, but these feelings keeping you from asking for the help or not knowing where to turn to get the help, to get the resources. And, unfortunately, we see this play out in a mother's mental health. So, we see this, pretty early on. We start to see the red flags during pregnancy.
Yep, agreed. Thank you so much for that, Teneele. The next question is actually a very appropriate follow-up question. What are some of the most important resources or interventions that you provide that help mothers who are struggling with material insecurity? I think Beth, Teneele, and Maria, each of you wanted to contribute to that question. So maybe we'll start with Beth.
Great, thank you. So our model is very holistic. We have a wraparound service model. We believe in holistic care. As we've said already on this call multiple times, our needs are interdependent, right? And we really are able to support individuals by building them up across multiple areas of vulnerability. So all of our clients who sort of access our in-kind support diapers from ShareBaby, our food pantry, clothing, things like that, they're enrolled in one of our case management programs. So most clients have a case manager with us for about a year, but it does depend a bit based on their need and the program. Referrals to medical care and mental health care. We've spent a lot of time trying to build up partnerships. Most of our clients are uninsured and uninsurable. So we've worked a lot to build up partnerships to make sure that these clients can access medical care and mental health care, as well as we do housing, we do rental assistance. We have English classes on site where clients can come, and it's a lower barrier to help them learn English. We also have in-house, immigration legal services. I think a big source of anxiety for our clients is, are they being able to stay? Are their kids going to be taken from them? And helping them get their apply for the legal the immigration relief that they need, and providing the support to do that. And then one of our biggest things is community connection. So we provide a lot of we have community lunches a couple of days a week. I mean, we enrolled clients from over 34 countries last year, I believe. So we have a wide mix of cultures, languages, backgrounds. But the biggest thing that we try to bring clients together, and we also have an evening program for immigrant trafficking survivors, many of whom are teenage parents, some of whom are the children of their traffickers as well. So just bringing them in and creating these points of connection. And I think it's all important, right? The food pantry, having a case manager, having medical care. But I think a really important piece is the community connection of the showing you're not alone. You're not the only one going through, this similar situation. And we have a lot of clients who maybe are farther along. They've been with us 8, 9, 10 months. They're getting more stabilized. And they'll sort of identify brand new clients the day they're enrolled, sort of see their wide eyes as, there's a lot of chaos happening in our building, and kind of take them in and show them, just help them feel acclimated that they're not alone. And I think having those activities, group therapy on site, a lot of those things, I think are really helpful and even essential. I think to Anna's point, I think a lot of the other panelists have brought it up, this point of community. I think there's a lot of beautiful, wonderful, very successful ways to do it. And I think for us, it starts here, but doesn't end here with us, right? We help clients get integrated in the community, and just, I think a lot of it. And then also as well, we don't tell clients what their case management goals are, what their goals are for their children, what their, clients tell us what they need help with, and then our work is to support what they need. So that builds autonomy, confidence, a sense of self. And, clients come to us with a wide range of needs, but I think trying to have accessible, when clients are vulnerable in all areas, how can we make sure we can sort of build them up across areas and not, and bring them up to, so they can feel stable on their own. And I think for mothers particularly, especially mothers without other support, and most of our clients are separated from family members or are here alone, having a place where they can, someone that they can meet, that can watch their kid while they go to a job interview or do something like that, or a place. I mean, we have a number of clients who tell us, especially right now in the current climate, that this is the only place that I feel safe is our office. I mean, I think that's probably the best thing anyone could tell me about my, my work and the work that we do in this period of time. So, and I think it's great that this is a place, but because of ShareBaby, they can come and get diapers and formula and things that they need for their kids. But it's also, it's a part of a whole, and we need the whole, to really build it up. But I'm so excited to hear what the other panelists have to say about their approaches as well.
Thank you so much, Beth. Maria, would you like to go next to answer that question?
Okay, so I support this mom by providing with valuable resources from ShareBaby. I mean, I connect them with the local organization where they have food banks, like churches and other organization. Because I'm partnered with the Judy Center. Sometimes I refer them to them because they work with the parents who have children from 0 to 5. That's a good place to go for them. And I do, I try to do some events where I get a lot of people together, so they really stress. So because in the couple, maybe three years, I've been working in this track where we track all the women that we are serving, and I can tell the difference. If you can go back to the 5 years ago, because I'm doing this for a little while, I compare the amount of people that are having more stress, having a premature baby. That was not, we didn't see that very often on Latino women. They having very low weights. Sometimes they have preeclampsia. They develop preeclampsia during the pregnancy. His diabetes has such so a lot of stuff because all of the stress that they have. And unfortunately, this new administration is not helping at all, because on top of that, sometimes they cannot even go to work because they have they're scared about, you know, that it's a lot of comment that immigrant like ICE is somewhere getting people, so people are afraid to go out more. So it's a lot for your mind, and when you are pregnant, you are very sensitive, you know, you need the least you want is so all of these problems. Those women face so many issues in their life.
Yeah. I think it is really important, and I think you really touched on something that, you know, there are a lot of people who know they need the help and are afraid to leave home or their local area to get it, simply because of the current climate in general. And I think, again, having each of you, all of our partners in the community in different places, covering different areas and in addressing different aspects of life. Maria, you mentioned the Judy Centers. And for people who don't know what they are, they're early childhood learning hubs that are centered within Baltimore City Public Schools. So they're in community schools. So they serve the teachers, they serve the families of the students, and they also open their doors and serve the community. And so there are 15 of those around the city. They work throughout the state of Maryland. But the ones that we have in the city are absolutely amazing partners, because not all of our partner organizations work with the public. They may just be a client-based service that provides really, really full and deep wraparound services. But those duty centers that you were referring to, Maria, are really super important, because when we, even as ShareBaby, when people walk into the warehouse and ask for something and we can't give them items, which because we don't do that, we generally will send them directly to a duty center, because that's, you know, that's where they go. But they're usually very convenient and close. Families are not wanting to go further than a few blocks outside of their home area for that very reason. They don't know who they're going to run into, or whether they'll be safe, or if they'll even be able to go back home, you know, to their residence. So, you know, having all of you dispersed throughout the city, and being able to provide those services is really critical. You all just being that trusted partner to families in their local, hyper local areas, really critical. Teneele, I think you signed up to answer that one also. Would you? I'd
I
love to hear from
did.
you.
I did. So through community partnerships, such as the one we have with ShareBaby, we're able to provide our clients and families with diapers, wipes, formula, clothes. We also enroll clients in our home visiting program, where they are paired with a neighborhood health advocate, and through home visits, they are provided with pack and plays and any other emergency needs that come up during and after pregnancy. Also, we make mental health referrals when needed, and also connect our clients to our high-risk nurse, so that way any high-risk needs that come up during and after pregnancy are addressed. They also are connected to resources around family planning. Also, our clients receive support groups around pregnancy and postpartum and fatherhood. Our Belly Buddies support group supports women that are pregnant around the same time. Our Mama Circle is an extension of Belly Buddies and supports new moms and those who are recently postpartum. Our fatherhood engagement sessions really get the dads involved with regard to how to have healthy connections and interactions with their partners and with their children. And our housing university helps to educate clients on how to be better tenants, and also educates property owners and landlords on how to be more understanding to the unique needs and situations of tenants. We've been able to provide rental assistance and eviction prevention. We also have our Healthy Start store, where our clients they're given bucks, and they're basically kind of like our little fake Monopoly money, and they're able to use those bucks at the Healthy Start store to get cleaning supplies for their homes, to get other personal needs for themselves and for their children. And they're given bucks when they, when they complete, such as, let's see, if they go to a doctor's visit, or if they come out to one of our community events, which is another way that we're able to provide resources and interventions to our clients and families, just further enforcing that sense of community and kinship amongst the folks that we serve. And also, our food pantry is able to provide, food and just staples to clients and families. The food pantry typically serves about 500 individuals per year, and this includes the elderly. And also just to touch on what I mentioned earlier about just that life course perspective and just recognizing the entire circle. We've been able to provide feminine hygiene products to young girls and teenage girls in the city to address period poverty. So these are just a couple of examples of how we're doing our small part to address material and other types of insecurity amongst our clients and families.
Thank you so much for that answer, Teneele. And Anna, I'm going to direct the next question to you. I think prefacing it with just a statement, I think all of us worked and we hope to organize ourselves straight out of a job. We know that policy is important, supportive policy and laws and budgets to enact those policies is really, really critical to all of our social supports in the country, in the state, and certainly in the city. And so having said that, at ShareBaby, we hope that there will be a policy solution for diapers. The fact that people cannot purchase diapers and wipes with SNAP or WIC is questionable, and it's honestly ridiculous. Those period products, paper products, those are absolutely critical to the ability for a mother to be able to go to work, take her child to daycare and go to work, go to school, and do all the things that she needs to do to take care of her family and take care of herself. So we're hoping at some point in time that we will be able to affect a policy solution for diapers at least. But I'm curious about your perspective about what we can do here in Maryland to advocate for children's basic needs and mental health resources, Anna.
Yeah, thank you for that. Where do I begin? I think that during the pandemic, there was a significant formula shortage. I think we all remember that, right? I think that shortages like that demonstrate the need to be able to regulate and follow who has control of what and how they are getting to the community, right? A lot of the issues that we were having that were created by that had created that shortage were about monopoly and getting the product to the right people. And I think so we need to understand that each of us are policymakers, right? I did not go to law school. I know, when I was 5 and I was watching Gem on TV, I wanted to be a lawyer, but I did not go to law school. I'm putting my age out there. But I still am able to create a policy, right? And so the pathway to that is in the community, seeing an issue and saying, this is an issue, then this is affecting me. Who do I need to talk to in policy? Do I need to talk to a council person? Do I need to talk to somebody on one of the commissions? Do I need to do I need to go to Annapolis? Who do I need to speak with? But policymakers are public servants and are required to engage with you and to help you figure out the answer to your problem that you're having as a constituent, right? And so what I really want people on the call to know is that we are all policymakers, and that if there is a power in our hands to make sure that the things that we're seeing in our community, the things that we're seeing in our organizations absolutely have a component of policy to them and can be brought into creating more space in the policy realm. I think also being being present in these policy spaces. Right now, there's lots of town halls happening, right? There's a lot of letter writing campaigns, phone calling campaigns. You want to get to know the people that are advocating and that are supposed to advocate for you, whether they're aligned politically with you or not. Their job is to listen to you and to respond to your needs, regardless of if your policies match each other, right? And so I think that we need to take a real hard look at stuff like childcare, right? The childcare application in Maryland, it just went on pause, right? Because the system was overwhelmed with people that needed and were afraid of having access to childcare. So we need to talk about what it looks like to find funding and to funnel funding into programs like that help our community. Because what does that do? If I can afford to take my child to daycare, then I can go to work, then I can, get the things that I need, right? And so funding is a thing, but also being able to understand that there's not just one person doing the thing, right? And so if you throw some funding over at Beth, that's not going to fix everything, right? Because Beth is one person and one organization. Sending it over to Teneele, and I did it to Teneele and Beth and policy, and now it's fixed. No, we really have to look at the budget and how to make sure that that budget is spread out amongst the entire constituent, right? Like, what does it look like to make sure that there is equal and equitable funding and support through policy to make sure that stuff like ShareBaby, that programs like Be More for Healthy Baby and Healthy Start and Asylee, everybody has a piece of the community that they are responsible for, and making sure that the policymakers that are responsible for all of us recognize that and can support us in that way. I think also there's some funding, there are some policy wins, right? Like with breastfeeding and having breastfeeding stations here in Maryland. Every employer is required to have a safe space, a safe, clean space that's not a bathroom for you to be able to breastfeed. And I think so. But that came from the community, right? That wasn't just someone in the office deciding that they wanted to make a change. And so again, I want to drive home that we are the drivers in the policy that we're seeing happening or not seeing happening, right? So if there is a decision that's made by a policymaker that you don't agree with, you have the absolute right to sound off, to gather, to write, to show up at their office, right? And to let your voice be known. And I think that there is power in that. There's power in being engaged in a legislative session. There's also power in being engaged just in policy, period. It's not that one day you go to your school or your local library and you press a button. There's much more work that can be done that can influence the trajectory of the things that we need in our community. And again, Nadya, you gave me a soapbox. I don't know why you would do that. So I hope I'm answering the question. But again, things like security, material security, things like housing, right? We've heard housing as a barrier multiple times on this call, on this webinar about in relation to community, families, maternal health, mental health, material need, right? And so housing is something that we absolutely need to work on. It breaks my heart to think about families that are dealing with potentially being disunited and moved and having to flee and hide and then also on top of that not having a safe place to put their head at night, right? And so I think it really is, and I realized this yesterday. I think that my work as a community organizer is really trumps the work that I've done in policy, because politicians can be interesting souls, right? And so I'm not I don't necessarily identify as a policy person. I more identify as a community organizer because I've seen the power that community together can working together can move mountains as far as the things that we need on a policy level. And so having a law is great. Making sure that that law has teeth is the work that we do as a community. So writing it into law is wonderful. Going through the process is absolutely great, but then holding, the organizations that's affecting accountable, holding the systems that it's affecting accountable is where the real work begins. And that's absolutely community. And so I've said it 4 or 5 times. We are all policymakers. We are the ones that are holding folks accountable to make sure that the changes that we say we need are actually happening. I think we need to really look at housing as far as supporting our families. We also really need to look at being able to figure out how we can track numbers, right? And so that's something that is not happening anymore, or not supposed to be happening, tracking the demographics and who's affected by what. And so figuring out and understanding how we can do that, so we're making sure that the need is met where it is, and the people that need the support get what they need. And then always, Teneele can tell you this, I'm always running, blowing the horn for funding. Everybody needs to be funded. I don't want to hear about how we're in a weird funding. No, the God that I serve says you can have whatever you want. And so we need funding across the board. These organizations need funding and support. And we can do that by knocking on the door of policymakers.
That was a great answer. And you're absolutely right. I think anyone who manages a budget or creates a budget understands that our budgets are demonstrations of our values. It is really, I don't know, I'm trying not to curse, but it's really interesting that folks want to ask us to have more children and, to continue to populate the earth without a supportive budget in order to do so. The nerve, the gall, the audacity of that request when we are not even supporting the families we have currently well. And so to your point, what I'm hearing you say in essence is that ShareBaby needs to organize all of our partners into a coalition, and we need to get our slate together and go to our local and state government and our federal government eventually and make some really succinct asks. Because if you don't have a place to lay your head, what do you do then? Housing, food, energy, transportation, which is abysmal in Baltimore City. Those are the things that make things really difficult for families of all ilks, regardless of your socioeconomic background. When we support the most vulnerable, everyone benefits from that. We know that. So I'm hearing you say that we need to organize, Anna. You're putting more on my plate, but
Their power in numbers. You got a policy person right here, Nadya.
You're right. Well,
we can.
Yeah.
What I say is, I can show you better than I can tell you. And if there's a group of us showing, if we are united and there is a plan, there is a list, there's a legislative agenda that says this is what we want, and we show up united, you can't say no to that.
Yep, I hear you. And we do have the data. You all give it to us. And so we do have the data. And we have it together. And again, here we are all doing the work together, and we have the numbers, we have the data, and we can make a case. So, okay, for legislative session, we will get our collective ducks in a row. Thank you for that. If our board chair Molly is on the call, she is our policy wonk. We'll get it together, and we will organize everyone. So we're gonna wrap up. This is gonna be our last question, and anyone can certainly answer. I would like everyone to answer, and please try to keep your answer to, if we can, 3-4 sentences. I think it can really be that simple. The question is really why is this so important to you personally? And once everyone is able to answer, then we will open up the floor to questions from the audience. We have about 14 questions or 14 statements in the chat, so we will go through there and answer questions. So let's see, Teneele, you're unmuted. Why don't you go first?
So to answer the question, this type of work and addressing this particular need is so important to me personally because I can speak for myself and I feel pretty safe and confident saying that in varying degrees, um, everyone on the panel today and everyone on the call today knows what it's like, knows what it feels like to go without, knows how vulnerability feels, knows what it is to be in lack and to not have. And I think being in that position and having familiarity around that should make this important to everybody because it's not a comfortable place to be in.
Agreed, agreed. Thank you so much for that, Teneele. Who'd like to go next? We can popcorn it. Beth, I'm looking at you.
Right, sure. This is important to me because I believe in human rights. I believe in children's rights. I believe it is unconscionable in any nation, but especially an affluent nation, for people to go without, especially for children to go without. I believe that it's an affront to humanity, to human rights, and all kids deserve the best that we can give. Adults do too, but especially kids deserve everything. We all have inherent dignity. Everyone's dignity is equal to my own, and everyone deserves the best that we can give, and no one should go hungry or without in a country with so much affluence.
Absolutely, Beth. Say that twice. Maria, please feel free to answer.
Okay, it's very important to me because those family that I'm working with, they're really in need, and I can see that. So the most important thing for me is that the baby come healthy and the mom stay healthy during her pregnancy. So any type of help that I can give, I will support. I will try very, very, very hard. I always do it.
You do, and thank you. We're so grateful for your efforts. You and I have had many side conversations about the communities that you serve and the impact we all have, and it is so evident in your passion. You really go all above and beyond. And we see you multiple times a month picking up for all of the entities, so it's really, really apparent. And Anna, why don't you finish us up here?
Sure. This is important to me because I see how transformative just a little bit of help can be. When I started Mom Cares, I was navigating domestic violence, housing unstable, and was very much unable to take care of a lot of the needs that I had. But because of the support of others, right, I was able to, I'm now sitting in my house, my home that I own, right? And that's just in the space of a couple of years. But I've also been able to see families be transformed by just the dignity of being able to ask for help without being judged, with knowing where to go and saying, I trust you, this is what I need, and being able to get it without questions asked. And I know that that's transformative. I know that having access to the things that you need does something to your trajectory, your success, your ability to feel confident in yourself, in your home, in your parenting. And I know that that changes the world. It doesn't just change a family. It doesn't just change a mom. It reverberates out into the community and out into the world. And I know that just kindness and compassion and understanding can really change lives. And I've seen it, I've experienced it myself. And so I think that this is always going to be important. And it's the glue that's holding us together as a community right now.
Thank you so much, Anna, and thank you so much to all of our panelists. We, again, cannot thank you enough for all of the work that you do. You bring our work to life. Our job is simple in the sense that we fundraise, we engage the community. We encourage people to give. We organize the things. We stock them in the warehouse and we prepare them for distribution. But you all do the really, really difficult work of wrapping your arms around each and every single mother and family and caregiver that comes into your doors. So thank you all so much for your passion, your longstanding advocacy and stewardship through your entire professional career on this. And I really do look forward to extending these conversations further. I think there were a lot of things that we've discussed today that have been raised that we really do need to dive in. We really need to talk about systemic oppression and systemic injustice, and some of it born right here in Baltimore. Cough, cough, redlining. There's so much of that, but there's so many aspects that we really need to dive into, and I think having these conversations is really helpful to folks who don't know a lot about material insecurity or don't even think that it exists, because they're able to, make ends meet, even if they're meeting very barely. They don't think about that as being material insecurity, but it is. And so there are places where we don't identify ourselves. That we really do sit and it affects everyone. It affects every single person, whether you have children or not, because it's all of our jobs to take care of children, and it's all of our jobs to take care of families. We need each other, and I think this rugged individualism that we boast here in the U.S. is an absolutely destructive myth. We're not alone, and we need each other, and I think it's really important that we continue to build our communities in that way. So again, thank all of you. I'm going to take a quick second and look through the chat and see if there are any questions. I think there was some named Lisa that had questions, but I don't know if she's still here.
Hi, Nadya.
Yeah.
I just looked through everything. There aren't any questions, but I just want to invite everyone. We do have a few more minutes with our panelists today. So if anyone has any questions, you can either drop those in the chat or the Q&A button on your screen. You can put them in there, and we'll be happy to address those for you. In the meantime, the reflections, our closing poll is open. Thank you to everyone for doing these. We've gotten some really valuable information and feedback from these. And just to share while we wait for questions, that in the closing poll, I loved seeing that we're asking folks how likely they are to take action or advocate in this area after today's panel. And 67% said very likely and 33% said somewhat likely. So that's 100% of people who are participating in this poll are saying that they are inspired to take action. So thank you all for that. It's very exciting. And thank you to our panelists. Yeah, we'll give it 1 or 2 more minutes and then I'll close this poll. And if no one has questions, then we can wrap.
Okay, thank you so much, Alicia. And everyone's contact, all of the panelists, our contact information is on the screen now. So if anyone wants to reach out, you can reach out directly to each and every panelist. And as a resource, if you know of families that need mental health support, particularly mothers who need mental health support, the National Maternal Mental Health Hotline is here for you. Moms can call or text 1-833-TLC-MAMA, nice and easy, to speak with a trained counselor. How important is this? And I think this would have been wonderful had this been around years ago. Motherhood, and particularly initial motherhood, can be such a joyful time, but it's not always that. It's really stressful. Even in the best of circumstances, it's really stressful. Knowing that you need some help and knowing that you need to talk to someone is half the battle, but being able to have a resource to do that. This resource was given to us by the National Diaper Bank Network, the umbrella advocacy organization of which we're a part. So all of us participate in this, by proxy, but this resource was given to us from the NDBN. And so we're really grateful for their partnership, and we're again grateful for the partnership of everyone here. We'll give it a minute, and if there are any questions or folks want to chime in. I don't see any questions. Well, if there aren't any questions, if anyone does have questions, you can reach out to us directly through our email addresses. Everyone did see them. If not, you can just reach out to us at ShareBaby, info@sharebaby.org, and we'll be sure to connect you to any one of the partner organizations that you can see on our website, and or the amazing panelists that we had